Turning now to the coronavirus here in Connecticut, and as the vaccine rollout continues, there are still many questions over the impact that it could have on fertility. Joining me now is Dr. Zaher Merhi, founder of the Rejuvenating Fertility Center. Doctor, thank you so much for being with us.
Thank you for having me.
So first off, for women out there right now, either pregnant or breastfeeding, can they get the COVID vaccine?
Well, it's a very difficult question to answer, because as physicians, we need some data before we counsel a patient whether a vaccine or any medication is safe. Now, the data so far has excluded pregnant women and breastfeeding women from their studies. That's why it's very hard to have a final definite answer as to whether the vaccine is safe for pregnant women and breastfeeding women. Having said that, if you look at the guidelines between the CDC and the WHO, the World Health Organization, they both really gave a little bit conflicting recommendation. The CDC says they recommend not telling a pregnant woman or breastfeeding women not to take the vaccine, so it's okay. But the WHO said do not recommend it for pregnant women. Now, the reason why there is this, they're both correct, by the way. The reason why it's allowed by the CDC, the basic, the biology or the mechanistic way of the vaccine, the way it's formed, it's not a live vaccine. It's not like varicella vaccine or rubella vaccine, which are live virus vaccine, can hurt the baby. The COVID vaccine is mRNA vaccine. So technically and scientifically speaking, we know that this type of vaccines usually do not go to the baby to enter the cells of the baby and causes problem, or through the milk. So that's why, even though we know mechanistically speaking it's safe, we still do not have enough data to support what we're saying.
Okay, I also want to ask you before you go, there's been a lot of talk about the vaccine potentially causing infertility, people writing all over social media different potentially unfounded things. What is the actual science behind whether that could be the case?
Well, there's really no science behind it, and I'm not aware of any single data that showed that vaccine can affect fertility or reproduction in humans. So I respectfully disagree with this notion, and I'm not sure how it started to go through the social media and stuff like that, but that's not true.
All right. Well, thank you for clarifying for us, and we appreciate all of your insight and expertise. Dr. Merhi, thank you very much for taking some time to be with us this afternoon.